the White Clinic's advanced bone healing protocols. What are we doing prior to placing an implant? What can we do to improve? So we've developed this protocol at the White Clinic, which will involve measuring vitamin D, lasers, piezo, ozone, PRF, and the ATP38. Let's talk about vitamin D for a moment here. We've studied and we've published recently, and it's on PubMed with Francesco Mangano, Richard Myron, very famous professor in America, and Dr. Napaj from my team, that if your vitamin D is low, you will have a higher rate of implant failure. So my question is, if you know this, why will you place an implant ever again in your patients that have low vitamin D? And yes, it's going to take a little bit longer, and yes, you should study this, and the levels are low, supplement. Take some vitamin D drops every single day. We recommend 10,000 units a day, plus some sunlight if possible. Not everybody can get that in the winter or in the north parts of the country, of the world, of the planet, but get those levels above 40. 40 to 80 is ideal, and you should really delay implant placement. And it's not fair to blame an implant company for early implant failure if your patient's vitamin Ds are low. That's your responsibility. I do not operate patients with low vitamin D. I always supplement, and if your vitamin D is low, we will delay until your vitamin D levels are high. Why? Because that's the science. So I can't just magically pretend or wish that I have a 100% success rate if my patient's vitamin D levels are low. The number two now is the rubidium YAG laser, which I consider to be a critical tool for bone decontamination and bone site preparation, using piezo and not high-speed rotatory instruments, because we all know that it's better for the bone and for the vascularization. Ozone therapy, very, very common and being more and more used around the world because ozone has proven bactericide, viricide, and fungicide effects. Why is that important? You take a tooth out that's got a massive cyst that's been there for 30 years. Can you guarantee there's no fungus there? Can you guarantee there's no protozoa or bacteria? And even if you give an antibiotic, even a broad spectrum antibiotic is not going to kill all bacteria. So it takes an extra 4 minutes to do the protocol per tooth site. And then of course PRF, not PRP. We publish on this as well, and Dr. Paj from my team is very, very good at this, and we're very lucky to have her. And then of course photobiomodulation, and of course there's many devices on the market. We use the ATP38 from Biotech Dental, and this also, if you're watching this in the US, just got FDA clearance and is now available across the USA. So we need to work with the companies and with the patients, connecting the patient to the companies, to the science and technology. We are the connectors as doctors. We owe it to the science, to the patients, and to our community to do a good job.